erosion of articular cartilage, sclerosis of bones underneath cartilage. Infectious inflammatory joint disease is causes by invasion of the joint by bacteria, viruses, and fungi. Non-infectious inflammatory joint disease is what? Inflammation is caused by immune reactions of deposition of crystals of monosodium urate in and around the joint. Rheumatoid arthritis is a systemic autoimmune disease that causes chronic inflammation of connective tissue, primarily in the joints. Signs and symptoms of rheumatoid arthritis: fever, malaise, rash, lymph node or spleen enlargement, Raynaud phenomenon. Ankylosing spondylitis. Chronic inflammatory joint disease characterized by stiffening and fusion or the spine and sarcoiliac joints. Gout is caused by an inflammatory response by the crystallization of uric acid and synovial fluid. What is the reticular activating system? All over the nervous system, awareness of yourself. What are the levels of consciousness? Confusion, disorientation, lethargy, inundation, coma. Level of consciousness indicates what? Improvement or deterioration, most critical index of function. What are some types of arousal alterations? Structural arousal alteration, metabolic arousal alteration, psychogenic arousal alteration. What is an arousal alteration? An altered level of awareness with acute onset may be caused by various factors. A coma is what? An abnormally deep state of unconsciousness cannot arouse by external stimuli. The two mechanisms of a coma: structural lesions, toxic metabolic states. Structural causes of a coma pertains to what? Divided according to whether the original location is above or below the tentorial plate. Pathological process pertaining to a coma are infection, vascular, neoplastic, traumatic, congenital, degenerative, polygenic, metabolic. Metabolic causes of a coma are hypoxia, electrolyte disturbances, hypoglycemia, drugs, toxins. Clinical manifestations relating to a coma: altered LOA may be organic or functional. Patterns in clinical manifestation help in determining the extent of dysfunction. Two concepts of neurologic dysfunction: respiratory responses are normal, abnormal. Examples of abnormal respiratory patterns are Cheyne-Stokes respiration, central neurogenic hyperventilation, ataxic respiration, apneustic respiration, diaphragmatic breathing. How does the pattern of breathing help evaluate a coma? Characteristics of respiratory patterns help evaluate the level of brain dysfunction and coma. Characteristics of a breathing pattern. Rate, the rhythm, volume. Cheyne-Stokes causes what? Hypercapnia and a diminished respiratory stimulus. What is Cheyne-Stokes a result of? From an increased ventilatory response to carbon dioxide stimulation. Anatomically, pupillary changes pertain to what? Brainstem areas that control arousal area adjacent to areas that control the pupils. What do pupillary changes indicate? The presence and level of brainstem dysfunction. Examples of diseases that cause dilated, fixed pupils, severe ischemia, hypoxia, hypothermia. Doll's eyes response oculocephalic reflex, normal response, is what? Eyes turn together to side opposite from the turn of the head. Doll's eyes response oculocephalic reflex, abnormal response, is what? Eyes do not turn in conjugate manner, or eyes do not turn. Oculocestibular reflex, normal response is what? Conjugate eye movements. Oculocestibular reflex, abnormal response is what? Disconjugate or asymmetric eye movements. Oculocestibular reflex, absent response is what? No eye movements. Types of extraocular movements. Conjugate gaze, disconjugate gaze. What do motor responses help evaluate? The level of brain dysfunction, and determine the most severely damaged side of the brain. Examples of motor signs representing loss of cortical inhibition are reflex grasping, reflex sucking, snout reflex, palmamental reflex, rigidity. What is decorticate posturing? Flexion of arms, wrists, and fingers, adduction in lower extremities, suggests hemispheric damage above midbrain. What is decerebrate posturing? All four extremities in rigid extension, with hyperpronation of forearms, extension of feet, associated with severe damage involving caudal diencephalon or midbrain. What indicates Pawnine level dysfunction? Decorticate posturing on right side of body, decerebrate posturing on left side of body. Disorders pertaining to a seizure. Temporary alteration in behavior or consciousness, caused by abnormal electrical activity of neurons in brain, incidence, morbidity/mortality, causes. Types of seizures. Generalized seizure, petit mal seizure, grand mal seizure, partial seizure, simple partial seizure, complex partial seizure, hysterical seizure, syncope versus seizure. Two most common types of seizures are generalized, partial. What are generalized seizures? No definable origin in brain, petit mal, grand mal seizures. What is a petit mal seizure? Often in children ages 4 to 12 years old, brief lapses of consciousness without loss of posture, often no motor activity, although may eye blinking, lip smacking, isolated clonic activity. What is a grand mal seizure? Common, associated with significant morbidity and mortality, may be preceded by an aura, warning of imminent convulsion. Characteristics of a grand mal seizure are sudden loss of consciousness with loss of organized muscle tone, tonic phase, clonic phase, prostictal phase if prolonged or occur before patient regains consciousness, status epilepticus. What are partial seizures? Arise from identifiable cortical lesions, simple or complex. What are simple partial seizures? Seizure activity in motor or sensory cortex, simple motor seizures, simple sensory seizures, Jacksonian seizure. What are complex partial seizures? Focal seizures in temporal lobe, manifest as changes in behavior. Classic complex partial seizure, preceded by aura, abnormal repetitive motor behavior, typically less than 1 minute, regains normal mental status quickly, may progress to tonic-clonic seizure. What are hysterical seizures? Mimic true seizure, usually terminated by sharp commands or painful stimuli. Psychological causes, not considered true seizures, no organic origin, do not respond to normal treatment. What are syncope versus seizures? May be difficult to determine, differentiating characteristics are in symptoms before and after event. Types of brain trauma: closed, open, coup contre coup, focal brain injury, epidural hematoma, subdural hematoma, intracerebral hematoma, diffuse brain injury. Types of mechanisms of injury for spinal cord trauma: hyperextension, hyperflexion, exonoloading, flexion rotating. Types of injuries for spinal cord trauma: concussion, contusion, compression, transection. Types of manifestations in spinal cord trauma: spinal shock, heightened reflex stage. Other alterations of the spinal cord: degenerative disorders of the spine, lower back pain, herniated intervertebral disc. What is a cerebrovascular accident? Brain attack, sudden interruption in brain blood flow results in neurological deficit. Incidence, morbidity/mortality, risk factors. Blood supply to the brain comes through what 4 arteries? Carotid arteries minus 80% of cerebral blood flow. Vertebral arteries form a basilar artery minus 20% of cerebral blood flow interconnected at various levels. Circle of Willis. What are the types of cerebrovascular accident? Both can be life-threatening: ischemic stroke, hemorrhagic stroke. 85% of cerebrovascular accidents are what? Ischemic. Cerebral thrombosis happens due to atherosclerotic plaques, extrinsic pressure brain mass. Cerebral embolus is what? Intracranial vessel occluded by foreign substance from outside the central nervous system. Signs and symptoms of a cerebral embolus. Similar to thrombotic stroke, usually develop more quickly, often have identifiable cause. What are the two protective coverings for the brain and spinal cord? Outer covering is bone, inner covering is the meninges. What are the three membranous layers from meninges? Dura mater, arachnoid mater, PM mater. What is the dura mater? Strong, white fibrous tissue consists of falx cerebelli, tentorium cerebelli. What is falx cerebri? Projects downward into the longitudinal fissure between the two cerebral hemispheres, consists of dual sinuses, superior sagittal sinus. What is the arachnoid mater? Delicate, spiderweb-like layer between the dura mater and PM mater. What is the PM mater? Innermost, transparent layer. Adheres to the outer surface of the brain and spinal cord. Spaces that exist between and around meninges. Epidural space, subdural space, subarachnoid space. Where is the epidural space? Located between the dura mater and inside the bony covering of the spinal cord. Contains a supporting cushion of fat and other connective tissue. Where is the subdural space? Located between the dura mater and the arachnoid mater. Contains lubricating serous fluid. Where is the subarachnoid space? Located between the arachnoid and the PM mater. Contains a significant amount of cerebrospinal fluid. What are the functions of cerebrospinal fluid? Provides a supportive, protective cushion, reservoir of circulating fluid, which is monitored by the brain to detect changes in the internal environment. Where is cerebrospinal fluid? Found within the subarachnoid space around the brain and spinal cord, and within the cavities and canals of the brain and spinal cord. What are cerebrospinal fluid ventricles? Fluid-filled spaces within the brain. 4 ventricles within the brain. Where are the first and second ventricles of the brain? one located in each hemisphere of the cerebrum. Where is the third ventricle of the brain? Thin, vertical pocket of fluid below and medial to the lateral ventricles. Where is the fourth ventricle of the brain? Tiny, diamond-shaped space where the cerebellum attaches to the back of the brain stem. What is the formation of the cerebrospinal fluid? Occurs by separation of fluid from blood in the choroid plexuses. Where is the spinal cord? Lies within the spinal cavity and extends from the foramen magnum to the lower border of the first lumbar vertebra. What are the nerve roots of the spinal cord? Fibers of dorsal nerve root, fibers of ventral nerve root. What are the fibers of dorsal nerve roots? Carry sensory information into the spinal canal. What are the fibers of ventral nerve roots? Carry motor information out of the spinal cord. Where are interneurons of the spinal cord located? The gray matter's core. What is a spinal nerve? A single mixed nerve on each side of the spinal cord where the dorsal and ventral nerve roots join together. What is the cauda equina? A bundle of nerve roots extending from the conus medullaris. What is gray matter? Extend the length of the spinal cord, consists predominantly of cell bodies of interneurons and motor neurons. What is white matter? Surrounds the gray matter, and is subdivided in each half on the cord into 3 funiculi, anterior, posterior, lateral. What are the important ascending tracts of the spinal cord? Rubrospinal tract, tectospinal tract, vestibulospinal tract. What is the rubrospinal tract? Transmit impulses that coordinate body movements and maintenance of posture. What is the tectospinal tract? Head and neck movements during visual reflexes. What is the vestibulospinal tract? Coordination of posture and balance. Important function of the spinal cord. Provides conduction routes to and from the brain. Ascending tracts conduct impulses up the cord to the brain. Descending tracts conduct impulses down the cord from the brain. Structural tracts are all axons of any one tract originate in the same structure and terminate in the same structure. Functional tracts are all axons that compose on tract serve one general function. What are the important ascending tracts? Lateral spinothalamic tracts, anterior spinothalamic tracts, fasciculi gracilis and cuneatus, Spinocerebellar tracts, spinotectal. What are the lateral spinothalamic tracts? Crude touch, pain and temperature. What are the important descending tracts? Lateral corticospinal tracts, anterior corticospinal tracts, reticulospinal tracts. What is the brain? One of the largest organs in the adult body. What is the structure of the brainstem? Medulla oblongata, pons, midbrain. What is the medulla oblongata? Lowest part of the brainstem, composed of white matter and a network of gray and white matter called reticular formation network. What are pons? Located above the medulla and below the midbrain, composed of white matter and reticular formation. What is the midbrain? Located above the pons and below the cerebrum. Forms the midsection of the brain, composed of white tracts and reticular formation extending divergently through the midbrain are cerebropeduncles. Conduct impulses between the midbrain and cerebrum, corpora quadrigemina, landmark in midbrain. What is the inferior colliculus? Contains auditory centers. What is the superior colliculus? Contains visual centers. What are the functions of the brainstem? Perform sensory, motor and reflex functions. Structure of the cerebellum. Contains more neurons than the rest of the nervous system located just below the posterior portion of the cerebrum. Gray matter makes up the cortex, white matter makes up the interior. Internal white matter or the cerebellum is composed of what? Short and long tracts, consists of the cerebellar hemispheres and the vermis. Shorter tracts of the internal white matter do what? Conduct impulses from the neuron cell bodies located in the cerebellar cortex to neurons whose dendrites and cell bodies compose nuclei located in the interior of the cerebellum. Longer tracts of the internal white matter do what? Conduct impulses to and from the cerebellum. Fibers enter or leave by way of three pairs of peduncles composed of inferior cerebellar peduncles, middle cerebellar peduncles, superior cerebellar peduncles. What is the inferior cerebellar peduncles composed of? Composed chiefly of tracts into the cerebellum from the medulla and cord. What is the middle cerebellar peduncles composed of? Composed almost entirely of tracts into the cerebellum from the pons. What is the superior cerebellar peduncles composed of? Composed principally of tracts from the dentate nuclei in the cerebellum through the red nucleus of the midbrain to the thalamus. What are the functions of the cerebellum? What is the diencephalon? Located between the cerebrum and the midbrain, consists of several structures located around the third ventricle. What are the primary functions of the thalamus? Plays two parts in mechanism responsible for sensations. Impulses produce conscious recognition of the crude, less critical sensations of pain, temperature, and touch. Neurons relay all kinds of sensory impulses, except possibly olfactory, to the cerebrum. What does the thalamus do? Plays part in the mechanism responsible for emotions by associating sensory impulses with feeling of pleasantness and unpleasantness. Plays part in arousal mechanism. Plays part in mechanisms that produce complex reflex movements. What are the structures of the hypothalamus? Supraoptic nuclei, paraventricular nuclei, mammillary bodies, infundibulum. What is the supraoptic nuclei? Gray matter located just above and on either side of the optic chiasma. What is the paraventricular nuclei? Located close to the wall of the third ventricle. What is the mammillary bodies? Posterior part of hypothalamus, involved with olfactory sense. What is the infundibulum? The stalk leading to the posterior lobe of the pituitary gland. What is the hypothalamus? Regulator and coordinator of autonomic activities. What is the cerebrum? Largest and uppermost division of the brain. Consists of right and left cerebral hemispheres. Each hemisphere is divided into 5 lobes. What is cerebral cortex? Outer surface made up of 6 layers of gray matter. What is gyri? Convolutions. Some are named precentral gyrus, postcentral gyrus, cingulate gyrus, and hippocampal gyrus. What is sulci? Shallow grooves. What does the longitudinal fissure separate? Deepest fissure divides cerebrum into 2 hemispheres. What does the central sulcus separate? Groove between frontal and parietal lobes. What does the lateral fissure separate? Groove between temporal lobe below and parietal lobes above. What does the parieto-occipital sulcus separate? Groove that separates occipital lobe from parietal lobes. The main function of the nervous system, along with the endocrine system, is what? Is to communicate. The nervous system is made up of what parts of the body? Brain, spinal cord, nerves. The organization of the nervous system is used to what? To detect changes in internal and external environments, evaluate information and initiate an appropriate response. The central nervous system is what? Structural and functional center of the entire nervous system, consists of the brain and spinal cord, integrates sensory information, evaluates it, and initiates an outgoing response. The peripheral nervous system is what? Nerves that lie in the outer regions of the nervous system, cranial nerves, originate from the brain, spinal nerves, originate from the spinal cord. The somatic nervous system is what? Somatic motor division carries information to the somatic effectors. Somatic sensory division carries feedback information to somatic integration centers in the CNS. Afferent division consists of what? All the incoming sensory pathways. Efferent division consists of what? All the outgoing motor pathways. The autonomic nervous system is what? Efferent division of ANS carries information to the autonomic or visceral effectors. Visceral sensory division carries feedback information to autonomic integrating centers in the CNS. Sympathetic division and parasympathetic division. The sympathetic division is what? It prepares the body to deal with immediate threats to the internal environment. Produces fight or flight response. The parasympathetic division is what? It coordinates the body's normal resting activities, sometimes called the rest and repair response. Glia support what? Neurons. The 5 major types of glia are astrocytes, microglia, ependymal cells, oligodendrocytes, Schwann cells. Astrocytes are what? Microglia are what? Small, usually stationary cells, in inflamed brain tissue. They enlarge, move about, and carry on phagocytosis. Ependymal cells are what? Resemble epithelial cells and form thin sheets that line fluid-filled cavities in the CNS. Some produce fluid. Others aid in circulation of fluid. Oligodendrocytes are what? Smaller than astrocytes with fewer processes, hold nerve fibers together and produce the myelin sheath. Schwann cells are what? Found only in peripheral neurons, support nerve fibers and form myelin sheaths. Myelin sheath gaps are often called nodes of Ranvier. Neurlemma is formed by cytoplasm of Schwann cells, essential for nerve regrowth. Neurons are what? Excitable cells that initiate and conduct impulses that make possible all nervous system functions. The components of a neuron are what? Cell body, dendrites, axon, cytoskeleton. The cell body is composed of what? Ribosomes, rough endoplasmic reticulum, Golgi apparatus, mitochondria provide energy for neuron. Dendrites are what? Each neuron has one or more of these, which branch from the cell body, conduct nerve signals to the bell body, and the neuron distal ends of these on sensory neurons are receptors. The axon is what? A single process extending from the axonilic, sometimes covered by a fatty layer of myelin sheath, conducts nerve impulses away from the cell body and the neuron. Distal tips of these are telodendria, each which terminates in a synaptic knob. The cytoskeleton is what? Microtubules and microfilaments, as well as neurofibrils, allow the rapid transport of small organelles. The function regions of the neurons are input zone, dendrites and cell body, summation zone, axonilic, conduction zone, axon, output zone, telodendria and synaptic knobs of axon. Classification of neurons include structural classification, functional classification. Structural classification has 3 different neurons. Multipolar, 1 axon and several dendrites. Bipolar, only 1 axon and 1 dendrite. Least numerous kind of neuron, unipolar, 1 process comes off neuron cell body but divides almost immediately into 2 fibers, central fiber and peripheral fiber. Functional classification of neurons is afferent neurons conduct impulses to spinal cord or brain, efferent neurons conduct impulses away from spinal cord or brain toward muscles or glandular tissue, interneurons. The reflex arcade is what? A signal conduction route and from the CNS, with the electrical signal beginning in receptors and ending in effectors. A nerve is a bundle of peripheral nerve fibers held together by several layers of connective tissue. What are the 3 layers of a nerve? Endoneurium, perineurium, epineurium. Endoneurium is what? A delicate layer of fibrous connective tissue surrounding each nerve fiber. Perineurium is what? A connective tissue holding together fascicles. Epineurium is what? Fibrous coat surrounding numerous fascicles and blood vessels to form a complete nerve. What are tracts? Bundles of nerve fibers within the central nervous system. Unlike nerves, they do not have connective tissue. Individual fibers may extend through both the nerve and the tract as it passes into or out of the CNS. White matter is PNS, myelinated nerve, CNS, myelinated tracts. Gray matter is made up of cell bodies and unmyelinated fibers, CNS, referred to as nuclei, PNS, referred to as ganglia. Mixed nerves are sensory nerves, nerves with predominantly sensory neurons, motor nerves, nerves with predominantly motor neurons. Are mature neurons capable of cell division? No, therefore damage to nervous tissue can be permanent.